Good morning. I'm Dr. Deuk, and it is now April 2nd, 2024. Our patient here today is from Michigan. He has back pain for over 10 years. We examined him and found that he has back pain coming from 3 discs. He also has pinched nerves. He has leg symptoms with weakness, numbness, tingling. His primary problem is his leg symptoms. He has a piriformis syndrome, which we're going to address later. But today we're going to fix the 3 discs that are bulging out, pinching the nerves in the lateral recess. All right, the first step to the surgery, which is endoscopic, is to get into the herniation. And the way we do that is we use a needle to get into the disc. Shot. Shot. So the first disc I like to target is the L5-S1. That is the hardest to reach. And in this case, it's going to be the hardest because it's so collapsed. I'm going to give him some medicine to numb things up a little bit while we proceed. If you have questions, feel free to ask them. In the meantime, Henry, you want to play our video on how is it that the herniated disc cause so much back pain. Shot? No, there is a lumbar Deuk laser disc repair. It's already done. Why don't you contact Tom Bean?
Oh, no, the lumbar Deuk laser disc repair, yes, we have that done. I thought you were referring to as the back pain, like why back pain, new animation. We don't have yet.
No, there should be, well, okay. So, Henry, why did disc cause back pain? Why discogenic back pain, the cause?
Yes.
That's the name of it. That is the lumbar inflammation.
Oh, okay. That we have. Yes, we have that.
Okay, that needs to be retitled as discogenic back pain.
No, it's already named that on YouTube, and yeah.
So that's why do lumbar disc cause pain. Then there is the Deuk laser disc repair, how to get rid of your discogenic.
And that we have as well. Yes.
Right. And then there should be a cervical. Well, there should be a lumbar facet pain, right? And there
yes, that we have as well.
Yep. A lumbar DPR for facet pain.
Yes.
Then there should be a cervical facet pain.
The cervical facet syndrome that we have.
And then there should be a cervical DPR, AP.
That we don't. That and the cervical DLDR we don't have yet.
Yeah, well, the cervical DLDR is not done.
Okay.
All right, but the cervical facet pain is done.
Okay.
So talk to Tom Bean.
Okay.
Let's get all those animations.
Yes, sir. Copy that.
All right, if you have questions, feel free to ask us. You can type up your question, whether you're on Facebook, YouTube, Instagram, Twitter.
We have a question from the Traveling Gringo on YouTube.
Nice, the Traveling Gringo.
Asking, hello, doctor, is there any beneficial that can be done for adjacent segment disease post-fusion as well as facet syndrome?
Yes, this surgery you're watching is the best treatment for adjacent segment disease It's also the best way to prevent adjacent segment disease. And we do treatments for facet called the Deuk plasma rhizotomy. And we don't have one of those to show you today, but generally we do, and you're welcome to tune in. If you go to our YouTube channel, you can actually see we have several Deuk plasma rhizotomy videos where you can see the latest advanced techniques in treating facet pain. All right, 5-1 is really tight, but let's go ahead. We're going to do bilateral 4-5, left 5-1, correct? Incision. So I have the needle at the 5-1 on the left. We need to get to the 4-5 on the left. And then we're going to get to the 3-4 on the right. And then we'll be in position. Very good. So keep the questions coming, I'll do my best to answer them. Right now I'm trying to get into the 4-5 on the patient's left side. And he is from Michigan, I believe, correct? And he has suffered with back pain for 10 years. He did not want fusion, and I don't blame him. He did not want open back surgeries like laminectomy. Henry, let's show our audience laminectomy. So there's a lot of people considering laminectomy as a treatment. And you can see from these videos that we're going to show you just how invasive it is. AP? Welcome back. Where do you feel that?
Where are you feeling that?
Where? In your back or in your leg?
Back.
All right.
Your arms, please.
You're doing great, by the way. We're almost done. Okay, so for those of you watching the surgery, the way the surgery works is we have to get into the discs that we're going to fix. That's the first step. And how long have you had back pain for? 30 years. Oh, wow. All right. So, and what would bring on your back pain? Huh? Oh, you fell off a roof 30 years ago. Okay. So he fell off a roof 30 years ago. And what makes your back pain worse? Activities or what? Yeah. All right. So sitting, activities, set it off. Sitting puts a lot of pressure on the disc. So he's had back pain for 30 years. He's getting a lot of leg symptoms. That's what brought him in. He was worried about the nerve symptoms. Are you comfortable? All right. Okay. Have you watched these surgeries before? How bad is that on a scale of 1 to 10? How high does it go?
9.
Is that where, 10? I heard him say 10. Is that where you get your back pain? L4-5 is a 10 over 10 concordant. All right, you can see the tear. Jordan, show us the tear in the back of the disc. So the first step in the surgery is get the needles into the herniations. The second step is test the discs to see if they're painful, but also gives me a discogram, injects blue dye into the disc so I can do the surgery. Is that better now? All right. Is it hurting anymore? Okay, good. How bad is that on a scale of 1 to 10? Is that where you get pain? Is that where you get your back pain?
That doesn't reproduce the back pain. What number was it on a 1 to 10?
It's a 10. It's where he gets his pain. All right. So, no, it was I thought he said 10. He said 10 at first. Yeah, now it's down because I'm not injecting, but. All right, so at this point, we've tested 2 out of the 3 discs. You can see the herniations. Jordan, show us the herniations. The herniation is the little angle, the little curve in the black curve there. And then show us the tear. The tear is, circle the tear. The tear is that whole area there in the back of the disc. There should be no dye, no black dye in that area, but there is. And the reason there is because there's a huge tear. And that's where the herniation has come out. That's pinching on his nerves. Are you better? Yeah. All right. I don't know that I'm in at 5-1. I think I'm right on the cusp. Shot? Yeah, I can't get any dye out. All right, we're going to put you to sleep, and when you wake up, we'll be done with your surgery. Okay? How does that sound? So 5-1, not testable, unable to test. Any questions from our audience?
At this moment, no current questions.
All right, let's show the video on how the Deuk laser disc repair works in the lumbar spine.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. Let me have a 4x4. Let me have a 4x4. Okay, now you can see what we're doing here in the operating room. We are going in and basically repairing the disc. Take this. All right, we need a little bit of alcohol on the field. Betadine, alcohol. We use a laser to clean the actual tear in the back of the disc. Go ahead. That tear is where the back pain comes from, and it's where the patient's herniation comes out to cause leg symptoms like numbness, tingling, and weakness, which this patient has. Let me have some more. All right. Any questions from our audience?
Yes, we have another question from the Traveling Gringo, once more on YouTube, asking, how can a patient tell the difference between pain from a herniated disc versus facet-related pain?
That's a great question, Traveling Gringo. You cannot. Only I can. A doctor and a trained, experienced person like me can. That's no different than saying, how can a patient do brain surgery on themselves? You can't, okay? You need a trained expert, and that's what Deuk Spine Institute does better than anybody else. Other doctors are unable to do it. They're unable to find the source of pain, and they're unable to treat the source because they don't have the technology and knowledge and experience to do so. So that is what we do at Deuk Spine. You want to know the difference? Then you get seen by one of our doctors. We make the diagnosis, and it may be that you have both. Shot? But it takes a lot of experience to make that determination. It's not something that you can just, watch a YouTube video on or read a book on, okay? It's taken me many years of training and experience to be able to figure it out. All right, this dilator's going in very easily. Can you pull this, please? That's because there's a huge tear in this disc. I mean, huge.
Can I have another?
What's the issue? Bent? Bent?
Over here. I think. Yeah. It's gonna pull the. It's gonna push actually the. I need another suction.
Let me have irrigation. Move.
Working sleep, please.
Irrigate. Down here.
I think it's gonna push the.
Shot? You think it's a dilator?
I think it's a dilator. Yeah.
God damn it.
Yeah, yeah. I got it.
Who's checking this stuff?
I see.
Huh? Let me have a guide wire. Fucking ridiculous. Shot? Hold on. Shot? Shot? Oh, fucking damn it. Shot? All right. Shot?
Good.
Take it out. I need to meet with Ron and Chelsea after this. Will you remind me?
Yeah, yeah. Of course.
I think we're in.
Yep.
Good. Okay, we're starting at left L4-5. Left L4-5. So far, we've lost probably 2 nosebleeds worth of blood, probably 10 cc's maximum. Everybody's different. Some patients bleed a little more than others, but our average blood loss is around 2 cc's, which is 2 milliliters. It's about half of a nosebleed. Any other questions?
At this moment, no current questions.
All right, why don't we go over the videos when I get back there so I could see what you've got on YouTube?
Copy that.
Where's the irrigation? There it is. Have that ready to go. We're not waiting. All right, there's the inflammatory area. There's really not much the grabber can do. Let's get the laser in. All right, I thought Jordan was doing processing. Why not?
I mean, he knows, but he's doing a procedure with a tail and MRIs.
We're not doing that many MRIs. We're not doing that many procedures.
I can talk to Monica. He can help me.
Hmm?
He can help me. I can talk to Monica.
Well,
Try him.
but we have almost 0 MRIs. I don't know if you know that.
No, I didn't know that.
Yeah. Well, you should find out, you know. That's what being a manager is all about, is being aware of what's going on in the company, not just, you know, your particular job. You know, it's about processing information, gathering information, analyzing things, making choices, decisions based on information, not just, you know, coming to work every day and doing the same thing. I know how intelligent you are. Do you know what Einstein said about evolution? Evolution is a sign of intelligence. Okay? The ability to adapt. Do you know what adapting means? It means the environment changes, so you adapt to the change. Okay? You improve based on the environment. You don't get left behind. Okay? So every day our company changes, right? Every day. So you need to be studying the change and understanding it and how it impacts you and the people that work under you. Or I have to do that for you, and I don't have time. That's why I pay you to do it. Okay? Don't just believe people. Oh, I'm going to do MRIs. Well, how many MRIs are there? Let me see the schedule. Okay? That's what you have to be doing. I know you know that.
Yes, sir.
All right, any questions from the audience?
At this moment, no current questions.
All right, so we've shown the what causes discogenic back pain, right? Inflammation of the annulus. We've shown the how the Deuk laser disc repair actually gets rid of the inflammation by debriding the tear, getting rid of the interposed herniation. Correct?
Correct.
We've shown a laminectomy video, which I'd like to see which one you've shown. This is all scar tissue, by the way, all this thick white stuff. And this is what pushes on the nerve. We talk about herniated disc, but it's not just a disc herniation. It's actually the scar tissue that comes from the inflammation. You see, herniated discs do shrink a little bit because they're mostly water. But scar tissue is not water. It's just thick, non-watery stuff. And that doesn't shrink. So that's what pushes on the nerve and causes most of the symptom. All right. This is right here, scar tissue. This is exactly what's pushing on his nerve. Literally this very spot.
We have a question from the Traveling Gringo once more on YouTube,
Sure.
asking, with your procedure, will scar tissue return again?
Scar tissue does not return with this procedure. What causes scar tissue is trauma and bleeding and inflammation. This procedure gets rid of inflammation. Therefore, it prevents scar tissue. What will happen is the annulus will heal. It'll seal itself off. And it does that with collagen. But the reason there's scar tissue is because of inflammation. The reason there's inflammation is because the herniation. So by removing the herniation and cleaning out the scar tissue and inflammation, you stop future inflammation. You get rid of any new scar tissue that would form. As long as the herniation is here, more scar tissue will form. So I really advocate people with a herniation in their disc, they need to get it fixed with this procedure, the Deuk laser disc repair, early, before it causes a lot of scar tissue. Okay?
Traveling Gringo also asks, is scar tissue visible on the MRI?
Yeah, it's a great question. The answer is yes and no. So the MRI, you need what's called contrast or dye to be able to see scar tissue. And you need to have a lot of it. So these patients, like this one here, they don't have a lot of scar tissue. They have strategic scar tissue. It's literally in exactly the spot where the nerve is. So you don't need a lot, right? Because the scar tissue that he has is literally right where his nerve is, all you need is a little bit to cause symptoms of nerve dysfunction, which he has. So you're not going to see a little bit of scar tissue on an MRI. MRI, you have to have at least about 5 millimeters worth of tissue. Okay? That said, could you see it? If you really look carefully for it in the right place, probably. But you're going to need to have dye injected. And we don't order MRI with contrast unless the patient's suspected of having a tumor, an infection, something really bad, you know, like unusual, but not for herniated discs. Nobody does that. So you're not going to see the scar tissue with the MRI. You're going to see it on X-ray? Absolutely not. You never see scar tissue on X-ray. You're going to see it on a CAT scan? No. Ultrasound? No. There is no test available today that will allow you to see this tiny amount of scar tissue that's strategically placed right where the nerve is. Okay? It just doesn't happen. I know it's here because I've done thousands of endoscopic surgeries, thousands of endoscopic discectomies. And every time I've seen it, every single time, it's here. That's what I'm removing. Now, what varies is how much scar tissue. The longer they've had the herniation, the more years, the more scar tissue usually. If they've had prior surgery, more scar tissue.
We have another question.
Sure.
This comes from Bo on Facebook,
Hello, Bo.
asking, when you are doing the laser surgery and you see or know the foramen is stenotic or stenotic, will you fix that or other things you may see or what the MRI just shows?
So, Bo, this surgery is the only surgery that really fixes foraminal stenosis because we are in the foramen right now. So we are treating foraminal stenosis as part of the surgery. Every single piece of little herniation and scar tissue I take out right now opens the foramen and treats foraminal stenosis. So this surgery is the only surgery in the world that literally directly treats foraminal stenosis without removing any bone or ligament from your spine. Microdiscectomy doesn't treat foraminal stenosis. Laminectomy doesn't treat foraminal stenosis. That's why so many people have laminectomy and microdiscectomy and they still have foraminal stenosis. You cannot reach the foramen with a microdiscectomy. You cannot reach the foramen with a laminectomy. The only way to get to the foramen, if you're going in the back of the spine, is to remove the entire facet joint. That's how you do a foraminotomy. You take the facet joint out. And that's what I used to do when I did open surgery. I used to take the facet joint out. All right. You can see the defect in the annulus where the herniation came out of. And again, all the white stuff is scar tissue. What I'm pulling out are little pieces of herniation, tiny. I just don't want to leave them there because they're going to keep the disc from healing properly. I want this area to heal over and seal off, and it will. Now that we've gotten rid of the herniations. That's pretty much it. I don't really see much else. And we're going to move on to the L5-S1 next. Yeah. Sure. That would help. Whatever you can do to help us with that.
You don't want to release side first?
No. Any other questions?
At this moment, no current questions.
All right, the nerve root is going to be right here to the left, kind of in that fatty tissue. But there's your defect. That's going to seal up nicely. It's about 3 millimeters. So we've taken it from about 7 millimeters before we started the surgery because it was being held open by the herniation. And we've gotten rid of the herniation, and now it's about 3 millimeters. Maybe 2.5. So by cleaning the tear, debriding it, we've given this patient's disc a chance to heal itself now. You don't need to put any kind of biologics in there. You don't need to put any kind of bone graft, no cage, nothing. All right, we're going to move on to L5-S1. That is a challenging level because it's so collapsed and because he has a high iliac crest. It's made it difficult to get to. That said, we're going to try to get in there. I expect to be able to. Let's go to lateral. Any questions?
At this moment, no current questions.
Removing the needle. Is that my latest shot?
That is correct, yes, sir.
All right. Shot. So I'm making my way down to the disc herniation, and we're using the dilator, which doesn't cut muscle, it spreads it. And you guys know what spreading means. Well, if you take a little pin and put it in your lapel of your shirt, wait. You take a little, like a safety pin or a little pendant, something, and you put it through your shirt. It doesn't cut your shirt fibers. It spreads the little cotton fibers apart. Then when you remove it, it looks great. You haven't cut your shirt. Shot. All right, take it out. Right? Shot. Shot. Yeah, it's perfect. Thank you. Yeah, he's perfect. I mean, he opened up nicely. You can see the disc space opened up beautifully. Yeah, it was good. It worked. That technique of, deepening the patient and then driving in the dilator works nicely. All right. I understand. And getting the dilator in the tube in is more challenging. But we're there. Okay, so the L5-S1 disc space is more collapsed, more scarred, harder to get into with our dilator, but we got in. Shot? All right, perfect. So we're going to clean this guy out. Now, he had really 6 areas that needed treatment, but we're doing 4 because we're doing the 4 worst. And I told him about it. It's just 6 was too much to do in one surgery. Remember, these are outpatient procedures. These patients don't go to the hospital, and we want them to make a full recovery and be able to go back to their home or hotel within an hour of their surgery. So we can't keep them under anesthesia for too long. It's not safe to do that. So we kind of limit it to 2 hours. Look at the steep angle. I'm literally up at his shoulder working because his iliac crest is so high that it's forced me to go really far north in order to, when I say north, I mean towards the head. Okay, that's what we mean in surgery, north. We're inside the disc. Okay, you can see the disc is gone. There's bone and bone. There's the area of inflammation and herniation in the back of the disc that's left. That's what we're here to fix. There's not much to do at 5-1 because putting the dilator in does most of it. You're really pushing the herniation from where it was pinching the nerve back into the disc, and then we use the grabber and the laser to remove those pieces of herniation. Any questions?
At this moment, no current questions.
So far, the surgery is going very well for this patient from Michigan who came to Florida to have this Deuk laser disc repair done. And he's getting 4 out of 6 areas of his spine fixed, and then we have a piriformis that needs to be done as well, which he's going to do it later. The piriformis treatment we do here at Deuk Spine is called the piriformis release. And we do a piriformis release that I created. It's a minimally invasive piriformis release. I was not the first person to do piriformis release. It's been around from orthopedics for a while, but the orthopedics do it open, where they're cutting through your butt cheek. It's very painful, very bloody. Most patients don't ever recover from that procedure. So we decided we could do it minimally invasive if we knew exactly where to release the muscle, and that best spot to release it is right where it attaches to the top of the hip bone. We call that the greater trochanter. Where is Davis? Will you call Davis? See if he can get the next patient. Well, I should go talk to her, but the next patient, we should probably get her in the other room. Okay? Get her positioned. There's a little bone spur, by the way, for those of you wondering why it looks different. Just about finished. Then we're going to move to the patient's right side because we're almost done with the left. A lot of calcification here, a lot of calcium. So we have a combination of bone spur and we've got calcification. Let's see the... All right, that's looking really good right there. Any questions?
Yes, we have 2 questions. This next one comes from Rich on YouTube,
Hello, Rich. Welcome to our live stream.
saying, Dr. Deuk, I've submitted my lumbar MRI already. I'm in the process of getting things scheduled. Am I able to submit my thoracic and cervical MRIs for review?
You can submit them, Rich. You get one free one. The other ones you either pay, I think it's $99, or if you schedule your surgery with us, you can have unlimited other ones for free. That's the way it works. So I'll leave it up to you to decide what you want to do. But yeah. Great question. Grabber? Yeah, I mean, even at $99 to have my opinion, an expert's opinion on what's wrong and how to fix it is a steal. Especially you get it from the convenience of your home. You don't even have to go to the doctor's office. You don't have to drive anywhere, fly anywhere. We do it all by Zoom. Zoom. Other questions?
Next one from Jerry on Facebook.
Hi, Jerry.
Saying, hi, Doc. Jerry in Vietnam. What's going on with Arias and his racing career?
Thanks, Jerry. Arias' racing career is pretty much over. It turned out that to get to Formula One, all they care about is money. They don't care about talent. Even though Arias is very talented, he's the most talented driver in the United States. The teams are taking drivers who are far less talented that we beat all the time. They don't even come in the top 5. And those guys are paying $5-10 million a year to be on the Ferrari team or the Mercedes team or the McLaren team. So basically it's all about money. And me personally, I can't support my son because financially it's too much. But also, you shouldn't have to pay to be an athlete it's a top athlete. You shouldn't have to pay for the opportunity. The team should appreciate it, want you, and support you. And that's not what happens. Even in IndyCar, the drivers are all either paying themselves, their parents are paying $5-10 million a year for them to be on the team and drive, or they have a family friend or business relationship that pays for them. So somebody is paying the team $5-10 million a year for that driver to be there. Well, there is nobody that's going to pay for my son to be there except for me. I don't leverage business relationships that way. Okay, I don't go to somebody I do $100 million a year in business and say, hey, sponsor my son on the Formula One team, or else I'm going somewhere else because I don't have $100 million a year in business, okay? So I'm just a small-time doctor. That's it. So we have no future because in racing they don't give a damn about talent. All they care about is money. And that's the God's honest truth. The biggest stars coming up right now in Formula One, like Kimi Antonelli, Arias raced Kimi and beat him. Arias was faster than Kimi any day of the week, an equal car. But now he's the new Mercedes future star. That's only because Arias is not there. And his father is a racer. Kimi has had hundreds of days of practice on the track, and Arias came and beat him without any practice. And he is the best in Europe. Take that. Kimi was the best driver in all of Europe. He's Italian, okay? And he's a top driver, but my son is better. Like I said, it's unfortunate, but that's how racing is. It just took us a while to figure it out. So Arias is at Princeton. He's getting straight A's at Princeton. He's pre-med. He wants to go to medical school and hopefully follow in his father's footsteps, become a neurosurgeon. The world needs him as a neurosurgeon. Most of you probably know that Princeton is the hardest school to get into in the world. It's ranked number 1 in the world for university. And he's over there doing very well his first year. He's a very smart kid. It's probably why he was such a good driver as well. All right. We are now starting on the right side. Once again, you can see herniation is blue. Scar tissue will be white. Inflammation will be pink and red. And the annulus will be white. The bone will be kind of a yellowish white color. So what's going on with our scrub tech search?
Well, last time was that lady, but
She was terrible.
no, she was not.
Yeah, but who else is available? Has Ron not brought anybody else to you?
No, from the outside.
Anyone?
No. That was the only.
How are you doing, Dr. Davis? Can you bring our next patient back to room 2? Is she ready?
Dr.
Ah.
I didn't see it.
Oh, okay. All right. All right. No, 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 no. That's all right. No, that's all right. We'll just wait.
Keep it moving. I got the bench drawn up already. Should be.
As long as you promise to keep things moving.
Oh, yes.
No delays. I'll be happy.
And the last case is just the one level. We're going to go in here.
Should be quick. All right. Any other questions? Yes, Dr. Davis.
Yes, we have a question from Ping.
Before we take the question from Payne, that lady whose foot we did,
Yes.
her pain is completely gone. I was telling Davis.
Yay.
Yeah, remember the foot? The DPR? She has no pain where we operated.
That's
She-
amazing.
There's some areas we didn't treat because remember her whole foot was hurting. So, but she said it's a miracle. And she was scheduled to have her whole foot fused. She went back to work the next day.
She would have been out of work for probably 6 months.
And how do I know? Because she works for me. She's actually working right now for me. So, anyway, I just thought you guys would like to know that. Go ahead, from Payne.
Yeah, Ping on Facebook.
Ping or Payne?
Ping, P-I-N-G.
Ping.
Asking, I'm wanting this procedure. I'm in the process of sending my MRI. Have you got any before and after MRI results of patients a year out after having the surgery?
Yeah, we don't do MRI results a year out. MRIs are useless unless you're trying to diagnose a source of pain. We're not trying to make your MRI look normal. If you want your MRI to look good after surgery, don't come to us. Go somewhere else because you'll never be happy. Okay? We're not doing surgery to make your MRI look normal. Nobody's going to make your MRI look normal. We're doing surgery to make you feel normal, and we're the only ones in the world that can make you feel normal. So come to us to feel good. Don't come to us to make your MRI look good. That's the easiest way I can explain it to you.
We have another question.
And by the way, I don't blame Ping because unfortunately there's a lot of misinformation out there. And Ping is just a victim of misinformation, as are millions of other people who think that you look at an MRI to judge the success of a treatment. You don't. You look at the patient to judge the success of a treatment, not the MRI. But that's okay because I used to feel the same way, you know. I used to think the same thing. Kind of brainwashed. Go ahead.
Next question comes from AAKK on YouTube,
Hello, AAKK. Welcome.
asking, what nerves did you perform the DPR on for the woman whose foot you treated? Superficial, perineal, calcaneal?
Yeah, actually, great question. So the lady that we did the other day, let me tell you a little bit about her. She had horrible arthritis pain in her foot. She couldn't walk. And of course, she was a very busy, she owns a floral company and does a lot of work where she's up on her feet all day. So she was miserable. She had tried injections, she'd had x-rays, and it was arthritis of the foot. And it involved several of the joints. These, what is it called? Metatarsal, phalangeal, and tarsal metatarsal joints? Tarso-metatarsal joints. Number 2, 3, and 4. And on examination, you touch her joints, squeeze them a little bit, and she jumped off the chair, right? So there was clearly a lot of pain and swelling and inflammation. And she told me she was scheduled for a fusion of her foot. And they were actually making some kind of synthetic foot or something, or joint, I can't remember what it was, for her. I mean, this is big money, right? Big production money. These companies are making millions of dollars off these surgeries. And I said, why don't you try our DPR? You know, we're not going to put anything in you. It's all natural. I'm just going to go in there and kill the pain nerves. If it works, great. If it doesn't work, go and do your fusion. She agreed. She trusted me. We did it, and her pain was gone immediately. I mean, no numbing medicine, no pain pills. We made 4 little 4-millimeter cuts on her foot, and we basically barbecued her pain nerves with our Deuk's plasma wand, and she walked out of there like not even an hour later, 30 minutes later. No pain. So, yeah. Which nerves? Well, the nerves to the 2nd, 3rd, and 4th joints. They're like digital. They're called articular nerves, or they're little digital nerves in the foot. No big nerves like peroneal nerve. That would be malpractice. Then they wouldn't be able to move their foot. So, yeah, these are just pain nerves, and they're located adjacent to the painful joints. All right. Huh? I got one more disc to go, and I'd say probably just another few minutes on this one.
He's doing well.
That's great. Thank you.
No current questions, but we do have a comment from AAKK once more on YouTube saying, excellent Dr. Deuk, with her pathology and how well her results were, the DPR may be able to be adopted to treat Morton's neuromas, given her path was in the metatarsal area.
Yeah, it's a great thought. You know, she did not have a Morton's neuroma. She had just arthritis of the joints. But, you know, it's certainly possible that you could ablate a Morton's neuroma as well. Haven't tried a Morton's neuroma. If you know somebody with one, I'm happy to try it out. But yeah, Dr. Davis and I were talking about this. There's so many people out there with foot pain that this procedure can now, you know, eliminate their pain quite easily and safely without having to have major surgery. The problem is our entire orthopedic and spine neurosurgical industry has been taken over by companies that are promoting highly invasive treatments like fusions, metal replacements, and the patient has really very little choice because all the surgeons are saying the same thing, which is highly invasive surgery, because that's how they were brought up. That's how they were trained. And the reason they're trained that way is because the universities are basically under the control of the companies that manufacture these implants. Through the use of grants and through the use of royalties and basically bribing the surgeons who make those decisions. And this is going to be, that's the herniation, by the way, the blue stuff. This is going to be the center of my movie that's coming out next year in December of this year, sorry. We're actually going to film in this summer, in June and July. So keep an eye out for it. We're hoping and expecting it to be on Netflix, if Netflix is willing to do that. And if not Netflix, it'll be on another streaming service.
Maybe we can get one of the implant companies to sponsor the show.
Yeah. Maybe we can get, you know, Medtronic to sponsor it. Oh, man. Hold the tube. All right. we're on to something here. We got a big piece of herniation. And I got to tell you, it was lateral. You know? Hold it. Oh, yes. Oh, yeah. Look at that, baby. That's a big piece. You see that, Henry?
Yes, we do.
All right, so that was wedged into the annular tear.
That'll be a game changer for him.
Yeah. It's a good thing we did this. Yep, just about done.
We
And-
have another question.
Yeah.
This comes from Ping, once more on Facebook,
All right, Ping, we'll take it.
saying, "Hi, my second question is it possible to speak with previous patients to see how they are doing a year or so post-surgery?"
Nope, not at all. Ping, I'm not sure what country you live in, but in the United States, we have laws against sharing patient information. And if you go to our website or our YouTube channel, Ping, we have hundreds of testimonials from our patients. Hundreds. So there's your evidence that you need that the procedure works. And if you say, well, I don't like that evidence, it's not good enough for me, then I would say, where is your evidence from other doctors, their procedures work? Show me a couple of testimonials. And then you'll say, sure, I'll show you 5 testimonials from this other procedure. And I'll say, I'll take your 5 and raise you 500, which is what we have now, 500 testimonials. So we have more testimonials from our patients on YouTube than any other doctor, any other hospital, any other treatment in the world. Any. And not just by a couple, but by hundreds. So, you're not satisfied? Usually I would just say tough shit. But I won't say tough shit because that's kind of mean. And I'm not a mean person. But I don't like people who are hypocritical. A hypocrite is somebody who expects one thing from one person but not from others, like themselves. So, in the United States, you're not allowed to share patient information unless the patient authorizes it. And the people you watch the videos, they've all authorized sharing their video. Glad you brought it up.
We have another question
Yep.
coming from Bo, once more on Facebook,
All right, Bo.
asking, how can something so soft, I am assuming that it's soft, but how can something that soft cause pain?
Yeah, it's a great question, Bo. It's not that it's hard or soft. First of all, it is hard because of the scar tissue. But that aside, the reason why it causes pain is inflammation. Okay? Take a pimple, for example, on your face. Have you ever had a pimple? Take your finger and stick it on your pimple and mash down. Does that feel good or does it hurt? It hurts. Why does it hurt? Not because your pimple's hard, your pimple's soft. It hurts because of inflammation. Same reason. This hurts, patient. Okay? But instead of mashing on your face on a pimple, these people stand up or sit down, and that puts pressure on their disc, just like putting pressure on your inflamed pimple. It's no different. They basically have a pimple in their back, minus the infection. A pimple doesn't hurt because of the infection. A pimple hurts because of the inflammation, your body's response to the infection. All right, one more to go. Great questions from our audience so far today. Shot. All right, this is going to be the L3-4 right side. Once again, place the guide wire down the needle, remove the needle, place the dilator down the guide wire. Dilator doesn't cut anything, it just spreads your tissue fibers. Remember, your tissues, your muscle, your fascia, everything under your skin is made of fibers, like the fibers in your shirt. And because you have fibers in your tissues, that means you can spread them apart without hurting them. Shot. And that's what we're doing. Shot. Shot. All right, let's take a look here. Could feel the herniation. Okay, let's remove the guide wire. Remember, this is L3-4. This has got a huge tear. This was a 10 out of 10 pain for him. That's like the worst pain you could possibly have. Somebody is ripping your arm off, it's 10 out of 10 pain. Shot. Now we're driving the tube into the disc through the tear. Now people ask me, aren't you hurting? Take it back, let's see. Aren't you hurting the disc by doing that? The answer is no. Shot. We're not, because the disc is already hurt, folks. We're not hurting something that's already hurt. If you have a cut on your arm and the doctor goes into your cut to take a piece of glass or dirt out, is he hurting your arm? No. The doctor is merely going through the area that's already hurt, and they're taking out something that shouldn't be there. And that's exactly what we're doing. We're going through the part of your disc that's already hurt, the herniation and tear, and we're removing the part that shouldn't be there, the herniation, and of course the inflammation. And scar tissue, which is a result of the inflammation. Any questions?
Yes, this next question comes from AAKK, once more on YouTube,
Sure.
asking, was the large lateral herniation you removed visible on this patient's MRI? And also, at what angle do you approach the disc with your original needle placement as you are near the Caben's triangle?
Yeah, so the answer is yes. The herniation is visible on the MRI in the lateral recess. In the foramen, in the lateral foramen. Number two, we are coming through Caben's triangle. We're coming from posterolateral, behind and to the side. Thanks. For those of you who don't know what Caben's triangle is, Caben's triangle is an area on the surface just outside of the disc in the foramen where there's no nerves and no arteries, nothing that you can hurt surgically as a surgeon. You can't do any damage. There's nothing there but fat and a few veins, so it's safe to work in that area. That's why it's called the safe zone. Caben's triangle is also known as the safe zone. And that's the approach I use to get to the safe zone. of the disc, just outside the disc, not the disc itself, but outside the disc, in the foramen. And the approach is, this is all herniation, by the way. This is a newer herniation. This is not as old, so you can tell. See all the blue stuff? That's all fresh herniated disc, okay? And I think probably what happened was he injured these discs a long time ago, but the L5-S1 was the main problem. See the blue stuff? This is the first time we're seeing a lot of blue stuff, right? That's because the blue stuff is the young herniation, like newer herniation. And it binds to the dye, the Deuk spine dye that we use. The dye binds to this because it's abnormal disc. The dye will not bind to normal disc. Normal disc is white. Normal nucleus is white, normal annulus is white. Okay? And the dye will never bind to normal annulus, and it will never bind to normal nucleus. It only binds to degenerated nucleus, which is acidic, ACIDIC, pH, less than about 6.8. The dye will bind, okay, and stain it blue. My favorite color. All right, 5 minutes perhaps, Dr. B. Wonderful to hear.
We have another question
Sure.
coming from AAKK once more on YouTube, asking, excellent, thank you. It looks approximately like a 45-degree angle. Is that near how laterally you start?
Yes, you're correct. It's about a 45-degree angle. Are you going to start doing these, AAKK? Sounds like AAKK is ready to start performing
I
our
know.
procedure.
I know.
Well, I hope not, because I make it look easy. But there's a lot of bad things that you can do to somebody if you're not properly trained. A lot of bad things. Speaking of which, the Deuk laser disc repair, we've not had any surgical complications. 17 years that we've been doing it, going on 18 years this June. I pioneered this treatment 18 years ago, almost. All right, see the herniation there, the blue stuff? That is all, look at the white in there, the scar tissue that's coming from the inflammation.
We have another question
Sure.
coming from Ping once more on Facebook,
Yes, Ping.
saying, understood. How common is it for the disc to leak post procedure, and what can a patient do to prevent this? And when you go into the disc through the tear for the cervical spine, do you have to make another hole at the front of the disc to access the back where the tear is, or do you still just go through the tear?
No. So first of all, we're not making any holes with this surgery, except the hole in the skin, which is 4 or 7 millimeters. Now, compared to other surgeries that make holes in your skin, your fascia, your fat, your muscle, your lamina, your ligaments, your facet, your disc, and sometimes you're covering over your nerves, we don't make any holes. So microdiscectomy, laminectomy, they make lots of holes in you. Our procedure makes 0 holes, except for the skin, which heals up very quickly.
We have another question
Sure.
This comes from Marcus on YouTube,
Hello, Marcus. Welcome to our live stream.
asking, "Hi, I wonder if radiating pain down the buttock and leg and weakness in foot, no pain in the back for a long time, 3 years, can be get rid of instantly, or if the nerve is really irritated, how long would it take?"
Yes, we can get rid of that pain for you instantly at Deuk Spine Institute. Nobody else will be able to do it for you, but we will. If I were you, I would do the free MRI review. I already know what's causing your pain. You can look it up if you want. It's called piriformis syndrome, spelled Piriformis. And we have a fix for it. It takes 15 minutes and the pain is gone. Why don't you type that up for him?
Copy that.
All right, 3 minutes. 3 minutes. Just about done. Any other questions?
At this moment, no current questions.
All right, type your questions up for me, folks. I'm going to come and answer them for you face to face. In the meantime, Henry, do you want to play a nice testimonial from one of our patients that we did surgery on?
Not a problem.
I think you have a new one, didn't you just release yesterday, right?
I did. I did not put it on here, but I could put it on for the next
Yeah, no
showing. I
worries.
apologize.
Sounds good. All right. So far, we did a great job. We fixed 4 areas on 3 discs. Look at all the herniation here. Incredible, huh? And I think this patient's going to do fantastic. He still has a piriformis we need to fix, which I told him and his wife. They're going to consider it, come back and get it done in the future. But you can see how nicely the laser cleans up all the herniation. By the way, the fiber, the glass part of the fiber there, not the blue part, but the clear part, that's 1 millimeter wide, 1 millimeter. So that gives you an idea of just how small all of this really is. 1 millimeter. All right. Go ahead and type up your questions, and I will come and answer them for you. This is scar tissue right here. But we are pretty much done. Yep. Oh, a little bit left right there. And he did fantastic. We lost, what do we say, 10 cc's of blood? 10 cc's of blood. It's like nothing. And this patient's going to go back to his hotel room, and I'm sure the pain that he came with is going to be gone, except for his piriformis. Type your questions up, and I will come and answer them for you face to face. So Luis, Henry, you can go ahead and
Copy that. Copy that. Apologies.
And
good morning. I'm Dr. Deuk Majan here at the Deuk Spine Institute with a patient who's traveled 10 minutes from Merritt Island. Is that correct?
I'm in Vieira.
Oh, Vieira, just down the street. Okay, local. You just had the Deuk laser disc repair on your lower back yesterday for a herniated disc at L4-5. It was a foraminal herniation, and it's one that is tough for doctors to find and discover. But we saw it at Deuk Spine, and you were having horrible back and right leg pain. That was yesterday before your surgery. Here you are less than 24 hours later. How do you feel?
Wonderful. Walking straight. I feel no leg pain, no back pain. Just a little sore, but that's about it.
How long have you had the back and leg pain for?
Since 2012, 2013, since my surgeries.
You live with pain.
Right.
He had, I guess, a microdiscectomy done.
Correct.
Did that fix him?
No, a month later he was back in surgery.
What kind of surgery did you have done?
The fusion, S1, L5.
So you had an L5-S1 fusion, good. Did that fix your problem?
No, not at all.
And their suggestion was take the metal out, and that they already seen that he had a problem with the disc above that one, so let's take the metal out first, then within a year go back and do another fusion on the disc above that.
And that was the metal they put in you?
Yes, sir.
So they put metal in you for the fusion, and then they told you afterwards, well, we got to get it out because that's what's causing your pain.
Right.
Kind of silly, isn't it?
Yes, sir.
All right, glad I'm not the only one that thinks that's a bit silly, but that's right, it is silly. And it's not just the surgery, the fusion. Didn't you have pain management and stuff in between?
Yeah, so I had shots and a nerve specialist do some stretchings and hands-on stuff, but that's about it.
So you had shots, you had therapy, and then you had surgery, and you had more shots and therapy. And that's the problem, is you're like I think about it as like a washing machine going around and around, and they're just washing the money out of your pockets and washing your life away because your quality of life has not been good, has it?
No, not at all.
How did you find Deuk Spine Institute?
My wife.
I couldn't believe it, amazing. Last time he had surgery, 9 days he couldn't even hardly move. And I mean, he was up last night pacing the floors, antsy, trying to find something to do.
This must cost your family a lot of money dealing with the pain. Over all these years.
Well, and it cost him not just, with the pain, he's not able to do the stuff he likes, fishing, throwing the baseball with our son. So just just doing life things he's not able to do that because of all the pain that he goes through. So now we're just so grateful that we found you guys because, I mean, I have not seen him walk like this in 19 years.
And that's just one night.
Yeah, that's just one night.
And
so,
no pain meds.
No pain meds, no anything, no medicine. He had took no medication whatsoever last night.
So just to recap, your husband, like millions of people, had back pain. He went and had microdiscectomy, which is a procedure where the surgeon basically ruins the back of the spine in order to get to the disc. That caused instability, which then he needed a fusion done shortly afterwards, right?
Yes.
You said a month later?
Yes, a month later.
And then you went back again because he was still in pain and worse after the fusion.
Right.
And they told you he needed another surgery, a third one.
Correct.
To get the metal out.
Right.
And then he was going to come back for another fusion after that.
Correct.
And then there would be more fusions and more fusions, right?
That's never ending.
Never ending. And we see this all the time with people that have open back surgery, invasive back surgery. Is a cycle of over and over, more and more surgeries. Well, he's done now.
Yes, thank you. And we're so grateful.
We have one more muscle thing to fix and then we're done.
Yeah, you may have to do something to me so I can keep up with them.
You ended up having faith. You had the surgery done yesterday. You can see in the video, we made a tiny little cut, just 7 millimeters on your back, and we got the whole surgery done. We found the herniation, we cleaned out the tear. And while you were in there, I tested your disc at L4-5 above your fusion, the one that's bad. You had 10 out of 10 pain. And I asked you, is that your typical back pain?
I heard that.
Yeah, and you said yes. So you're going to watch your surgery today. We gave you a video. Henry did a great job recording it and broadcasting it. But you're happy today. You've had your back fixed.
So I'm walking straight.
You're walking straight.
Walking straight, not leaning.
And do we have you on pain medications at all today?
No, nothing.
You didn't take any, did you?
Nothing.
You didn't need
Zero, nothing.
Yeah, with the cut on your back being that big, it's a Band-Aid. There's no trauma inside your body we're doing, so there's no need for pain pills. That's one of the nice things about Deuk laser disc repair compared to open back surgery like fusion, is that we don't do trauma inside your body. There's no need for pain medicines afterwards.
The fusion caused hernias, and I had a hernia surgery.
Really?
Yeah, because of the pain pills.
So all the complications from fusion, including, I've not heard that one, having to have a hernia surgery on your groin, right? Wow. So here's another complication from
Yeah.
fusions. Well, you're not going to have that problem anymore, are you?
No, sir. Hope not.
Well, is there anything else you want to share with your fans out there who are listening to your story?
The best thing that's ever happened to me. I'm walking straight, no pain. I feel like I can go do what I usually do, and especially fishing.
Yeah.
I miss that.
We're going to get you there. You're
Thank you,
welcome.
Duke. Thank
It's
you.
my pleasure. Get back to fishing.
Yeah.
I just want everyone to know, please make sure you educate yourself before you do this, because you only have one life and you want to make sure you live it to the fullest, and doing these back surgeries that these doctors recommend is not the way to do it. You need to come here and at least just give it a shot. Let them look at your MRI. I think you said you can do the reviews online if you don't, out of state, but please check here first and let Dr. Deuk, go through all of your records, because I'm telling you, this is the best thing that we've ever done.
I'm happy for you guys.
Oh, thank you so much. You just don't even know how, I couldn't believe it. My son was like, Dad, you're supposed to be laying down, and he's in there walking around, we couldn't keep him in bed last night. So it's amazing.
I'm here with a gentleman who came to the Deuk Spine Institute with horrible back pain, pinched nerves, symptoms down your leg, weakness, numbness, and using a walker. He's been struggling now for quite a while. You had the Deuk laser disc repair done yesterday in the morning. We went in with the laser and we cleaned out 2 discs that were really causing pain in your back. They were herniated and starting to degenerate. How do you feel today?
10,000 to 50,000% better. Absolutely wonderful. I can't even, it's hard to explain. Going from not being able to walk 5 feet to being able to almost just walk around the block. It's one day, it's 24 hours. It's incredible.
And when did you realize you had this relief on your back?
Yesterday, when I got home and got settled down, and there was no pain. There was no pain in the back. There was no pain all the way down the leg to the big toe. It was like, where'd the pain go? It just dissipated. And that's after surgery. So usually you feel like there's surgery, there's going to be some pain. No pain. I can't even explain it.
Well, you're doing a good job. What was life like before you had the Deuk laser disc repair surgery?
I didn't want to live this way. There was no way I would never want to live that way. Never want to, no. Excruciating pain. Can't sleep, awake all night. The pain was constant, it never left, but you got so exhausted from feeling the pain that you would finally fall asleep. I would finally fall asleep anywhere from an hour to 2 hours at the max, and 2 hours was a gift, and that's all night long. I had to sleep in the room by myself because I would have kept my wife awake all night. I was just miserable, the most misery I've ever felt.
I met your wife. She's a lovely lady. She's by your side all the time.
Yes, sir.
It's hard when you have so much pain. It takes a toll on you, but also your loved ones.
Yes, it does. And she's been a God's gift. I will say that.
Now, how does she feel about your surgery you had yesterday?
She's very happy for me. She's been through every day of it. And this started before Thanksgiving. And we are 3 days from Christmas. And I'm going to have Christmas without pain. Thank you, God. Thank you, doctor. Thank you,
welcome.
everybody in the staff. This staff is unbelievable. Nicest people I've ever met.
Well, we care about people like you. We want you out of pain and happy and getting on with your life. And tell me about your job. You have an interesting job.
I do. I love my job, and I call it the greatest part-time job in the world. One of the highlights of my job is something I can say about it is it's a job where you can say no to work and you'll have a job the next day. It's the only job in the world that I know you can do this. I'm a stagehand with the International Alliance of Theatrical Stage Employees out of New York, and I love my job. I do everything from entertainment, theaters, arenas, to trade shows.
What's the best show you did?
I've worked with 2 out of 4 Beatles. I've worked with, everybody from Kenny Rogers to Celine Dion. I've worked with Van Halen. I've worked with all big entertainment. And then I've done a lot of medical trade shows, so I know where I'm at. When I come into a medical facility, I look around and go, oh, I know where that comes from, and I know where that comes from. And it's a great job. It's a wonderful, wonderful job. I see things before normal people see things. I saw the first flat screen computer and I didn't think too much of it because I wasn't a computer person. Now it's like, look at the flat screen TVs, and it's a great job. That's the trade show side. The side where what keeps our country moving is people buying and selling the products that we use, from the cameras that are on us right now and the lights that are on us right now to doctor's coat that he's wearing and the shirt that I'm wearing. So
And probably
it's
some of the
incredible.
equipment we used in your laser spine surgery. where we
Absolutely. The best shows I do, I have to say, are the medical shows because I go around and I get literature and I read and I learn from past experiences with herniations. I've had double hernia surgery, so I know about that. I've had hand surgery, I've had knee surgery, now I've had back surgery. So I learn and it's, you get to talk to the people that do the work and represent the products, and it's pretty awesome. So I love my job. I miss it. I honestly miss it.
Well, now you're going to be able to go back to work without that pain.
Oh, thank God. Thank you. Thank you, Doc.
You're welcome. Is there anything else you want to say to your fans out there?
If you're having issues, any kind of issues with back, knees, joints, you need to come to Deuk Spine. You just have to. The Institute is wonderful. Everybody here, there is no negativity in this building whatsoever. It's unheard of out there. And I've seen a lot of doctors over the years for different reasons, but there's no negativity here. It's all positive and you leave positive. So I'm very, very happy that I did this. And I tell anybody that has ever gone through any kind of pain, you need to come see Deuk Spine. People come from all over the world, and now I know why. I just came from up the street, so I can tell you, up the street or from another side of the country, just come to Deuk Spine. That's the best I can tell you.
Well, thank you for sharing your story. Congratulations and Happy New Year.
Happy New Year and Merry Christmas to the whole staff. All your people are excellent, to your family as well and their families. And I hope everybody has a wonderful Christmas. And by the way, the office is magnificent. That is the best I've ever seen. That shows when you walk through this office for Christmas holiday, it's all about family. It's all about the holidays. It's about the people that come through.
Thank you.
Thank you
you very much. I just love those stories of patients who have been suffering with back pain for years and we're able to fix their pain with a simple procedure, just using our laser and endoscope. I get a lot of questions over the years about the procedure, Deuk laser disc repair. Yes, I pioneered it. I am the founder, and I learned the basic endoscopic technique from different surgeons that were pioneers themselves. For the lower back, lumbar, which we just completed, the first surgeon to ever do an endoscopic transforaminal approach in the lumbar spine was Dr. Parvis Kambin. And Dr. Kambin was an Iranian orthopedic spine surgeon in Philadelphia. He was at a university and he was teaching this technique that he developed. And basically, for those of you who don't really know exactly what I'm talking about, this is your lower back spine, and these are two bones. A disc is between them. This is the front of the spine. This here is the back of the spine. And all of spine surgeons, we're all taught to approach your spine through the back, right? If it's the lumbar spine. Well, over the years, we've developed different techniques, and now we come from the side for the X lift. We come from the front for the A lift. These are fusion techniques. You come from the back for a P lift and T lift, and then there's the O lift, which also comes obliquely. Point is, you can approach the lumbar spine, the disc problem, from different angles, back, sides, front, depending on what you're trying to do for the patient. If you're doing a fusion, you can approach from the front, sides, back. But if you're doing a non-fusion treatment, like a laminectomy, you always go through the back, microdiscectomy, through the back. Well, Dr. Kambin realized that there was an inherent problem of approaching your spine through the back, and that you're gonna, number one, you have to peel the muscle off the spine and destroy the muscle, but you also have to remove bone and ligaments from the spine to get down to the nerve where it's getting pinched to get to the disc herniation. So Dr. Kambin said, why don't we just come from the side instead? Now, nobody had ever done that before, and there were no tools or equipment to do it, so he had to build his own. And of course, when he did that, he ended up damaging the nerve quite a bit. But he taught one surgeon in particular, Dr. Anthony Young, that was one of his students, who then taught me. Dr. Young created his own scope that was smaller than Dr. Kambin's, narrower, and was able to navigate around the nerves without doing damage to them. Dr. Young had a 10% nerve damage rate, and Dr. Kambin had about a 50% nerve damage rate. So the 10% is much better than 50%. And when Dr. Young taught me, I developed my own technique where I have a 0% damage rate. So it's gotten better over the generations of people who do this surgery, but there's only about 5 surgeons in the whole United States of America that know how to do this type of surgery endoscopically. Now the laser part I brought in myself because the laser, once I started using it, I recognized the value of the laser in terms of the precision and the efficiency of removing abnormal tissue, including bone and calcium. There is no other tool in medicine as good. So by combining laser and endoscopic, I developed the Deuk laser disc repair. And now that's why people travel all over the world to come here for that minimally invasive endoscopic procedure where the laser cleans out the herniation and debrides the tear. I published my technique in 2012 for the first time and published it again in 2013 and published it many more times since then. But that's the surgery we just did today. All right, any questions from the audience?
Yes, this next question comes from Ping on Facebook,
Hello, Ping, welcome.
asking how common is disc leakage post-procedure?
Oh,
and-
sorry, yeah, I didn't answer that.
Yeah, and how can a patient avoid this?
Yeah, the disc doesn't leak. It's not like air in a tire, okay? The nuclear material in the center is thick and hard. And not hard like concrete, but firm. It doesn't just leak out. Now, you have to do something to make it come out. How common is it after my surgery? 1% of my patients will re-herniate. A new piece of herniation coming out into the tear and require surgery. 1%, 1 in 100. How can you avoid it? You avoid heavy lifting. You avoid contact sports. You avoid bending at the waist for lumbar. That's how you avoid it. And you do that for 1 year.
Apologies. This next question coming from, I love this name, Johnny Bravo on YouTube.
Johnny Bravo, yeah.
And then he asks, my L4-5 disc osteophyte will diffuse disc bulge and facet arthrosis with ligamentum flavum hypertrophy, resulting in severe central spinal canal stenosis with lateral recess stenosis and moderate to severe right and severe foraminal narrowing.
You write a book there, Johnny? Thank you.
With foraminal narrowing with impingement of L4 nerve roots with neuro.
He must have cut and pasted this thing, or he spent an hour typing.
He just asked, can you help me?
Yes, we can help you, Johnny. We can fix your problem. And you're going to want to know how can we fix it? Well, the same way we fix everybody else with exactly the same problem. Every one of these patients has what you have. There's nothing shocking, different, unusual about your problem. There is degrees. Some are milder, some are more severe, and there's everything in between. So there's a spectrum of disease, right? Like a bell-shaped curve. And 99% of the time, I can fix your problem with the laser surgery, just like we did. Maybe 1% of the time, the laser won't work, all right? The only way I can tell you whether it's going to work or not is if you do our MRI review. That's the whole point of the MRI review. It's not because I've got nothing better to do but to meet with people all day long and not charge them any money and do it for free, still paying my staff and my overhead. That's not why I do free MRI reviews. I do it because I must see your MRI and I must see you through a camera to be able to decide what is necessary to fix you. All right, so there's actually a reason for the free MRI review. It's so I can figure out what's wrong and the best way to fix it. I can answer those questions for you after you do your MRI review.
He did add, I'm sending my MRI that I just had last week, and I will also send a report as well.
Perfect. That's how you get the answers you're looking for.
Next question coming from Jacob on YouTube.
Jacob, nice to have you.
Asking, what about caudal migrated disc? How can you get it out?
Well, I assume you're talking about lumbar spine, Jacob. You're asking how can I get a caudally migrated disc out? Great question. It's not easy to do, and it's hard to do endoscopically. All right, we're going to use this model for the caudally migrated disc. What is a caudally migrated disc? Well, folks, just pretend that's a real disc, not an artificial disc, okay? So if you look, what is a caudally migrated disc? It's a herniation that goes backwards like everybody else's, and then it goes down. Caudally means towards the tail or towards your butt, right? So it's out, backwards and down. So it's kind of like hidden behind the bone right here. Now, Can I still get it? Absolutely. How do you do that? You change the angle that you come in. You come in from a top-down angle rather than a straight lateral. And if the migration was rostral, it went up, then I would approach it more from the bottom to go up. So you can adjust your angle of attack to the herniation with my procedure based on whether it's rostral or caudal migrated. Now this is the news flash. Do not expect any surgeon to remove 100% of your herniation. Whether it's back, side, up, down, doesn't matter. There's no surgeon on earth that can take away all your herniation. If you get an MRI scan after every single spine surgery, you're going to see the spine still looks abnormal. The point is, we're not there to make your spine look good. We want to get rid of your symptoms. And I can get rid of the symptoms with the laser surgery, even though you will not have 100% of your disc herniation taken away.
Lastly, from Ping once more on Facebook, asking what's your thoughts on MSC stem cell therapy injected around the discs post-treatment to speed up healing?
Yeah, I've been asked about stem cells, and we've even tried it. They don't work, all right? They're unnecessary. They don't add any value for the patient. They don't improve the healing. They don't improve anything. As a matter of fact, they make it worse for the patient because they create a lot of pain and inflammation. I don't recommend stem cells. They don't fix disc problems. All right? Any other questions?
That is it for questions. Yep.
We'll be back. We have a one level from a patient that came from Toronto, Canada. He has 3 disc herniations. The worst one is L4-5. We're fixing L4-5. I recommended 3-4 and 5-1, but he didn't want to get it done. So we're going to just do the 1 disc. I think he's going to have about 60 to 80% improvement. All right? But, you know, here's the problem. This patient that's coming from Toronto that's only getting 1 disc fix, right? This is the natural history of disc problems. You get a disc herniation, you get pain in your back or your legs, you get numbness, tingling, weakness, right? And then you take it easy because it hurts to do anything. So it gets better, you feel better, and you think, oh, I'm better. I don't need anything done. But what you don't understand is that once you make that tear and once you get that herniation, it's just a matter of time before it gets worse. The only fix for this is 2 things. 1, Deuk laser disc repair. That's the best. Number 2, take the disc out completely and put a piece of metal in there, which you don't want. That's the old-fashioned way. So really, it's the Deuk laser disc repair and nothing, in my book. Hope you enjoyed the surgery. Thank you, Henry. You've done a great job. We'll be back in about 45 minutes.